Okay, so hi, Carrie Ann, and I know we haven't got Gary on today. So, um, yeah, when we see clients, they want some tools. We're
Yeah.
seeing we're going to somebody's house, and we know that we say of go all curious, and we've made them feel the person, the center of attention, and that which is the most important thing. That they're not this weird person with living with dementia. That they have a value. They're still valuable.
Yeah.
They're
Sure.
still like human, because of course we would see people when they first get their diagnoses. Now,
Mhm.
however, we know that there is the journey of it, and we know that people, when they first get their diagnoses, they may well be in denial for a bit.
Mhm.
Once they've made the call with you, then they're not in denial. They're aware, and it's like,
Right.
okay, what's next? What
Yeah.
can we do? So and we've already discussed that we're looking at their eating patterns, their habits, what they can do. Can they have more coconut oil? We've got all the things. We've discussed all that at the beginning. Now, the fear and anxiety, I think, are always the biggest things that they
Sure.
need help with,
Mhm.
because it's the roller coaster of emotions that goes with that. So let's really think about what we can do as a really good pattern interrupt, because we both know that that kind of thing is the best thing to do.
Sure.
So there is this spin technique, and it's an NLP technique, and this is something that I use actually with a lot of my clients, if they can
Mhm.
feel that, that kind of like that feeling. So anxiety brings up a feeling, which is an emotion. Yeah. And it's emotion is energy in motion. Okay. It's pretty cool. Okay. When people go, oh,
And it is all energy.
yeah, because it's energy. And so I say, put your finger up. I go, it's always got a spin. And they're like, and I go, yeah, which way does it spin? Close your eyes if you have to. Which way does
Yes.
it spin?
Yeah.
Feel into that.
Mhm.
And sometimes they'll do that. Sometimes it will be, it'll be whatever it is. But generally, people will do that.
Mhm.
And they've got their eyes shut, feel it. And they can sometimes feel it coming up. I go, what color is it? What color is it? Well, has it got a sound? Has it got a texture? Is it spiky? Is it what is it? What is it? And so they're telling me. Sometimes it hasn't got anything, just a color.
Yeah.
Sometimes it hasn't got a smell, but sometimes it can be acrid. It can be pooey. It can be sicky. It can be, heavy. It can be turgid. It can be really, it's all those things. And I go, spin it, feel into it, feel into it, feel into it. And then they're really feeling it. Okay. And then I shout, stop. And of course they go like that. I go,
Mhm.
and now spin it the other way. And now they spin it the other way. And they're going, I go, now what color is it? Oh,
Oh,
it's white, it's yellow. Oh, it's got a different color. It
yeah.
could be green, because before it might have been red. It's going to be whatever it is for them. We know that.
Mhm.
And then and now what smell is it? Oh, it's like flowers. Now, how does it feel? Oh, it's just, I can feel it unraveling.
Yeah.
Isn't that cool? And
I love it.
yeah, and it's like,
Yeah,
no,
I love that.
no
Yeah.
drugs involved.
Yeah. Yeah.
You think no drugs involved?
Right.
And it literally,
They have to get into the whatever the feeling is, the emotion is.
they do. So
That's
practice
the
it, practice that with me now. Okay.
okay, Claudia. Is there for you something, anything that you would like to change or feel a little bit differently about?
Mm-hmm. Yep.
And there is something you have it in mind?
Yeah.
You don't have to tell me, I don't guess, really.
No.
Uh,
Yeah, that's the beauty of it. We don't have to
yeah,
tell anybody.
right. So, exactly then, imagine we're all spinning. Everything spins.
Mhm.
So just imagine that you're take your little finger and imagine it spinning. It can spin any way you want it to, but just imagine that it's spinning. Okay? And as you're imagining that spinning effect, you may notice a color. What color might you see? Color are you seeing?
Yeah, it's brown.
Okay, so it's brown and it might have a smell. Does it have a smell?
It's kind of musty.
Yeah. And what does it look like exactly? It could be smooth, it could be ripply, it could be spiky and pointy. What does it look like?
Yeah, it's got like lots of sticks.
Okay.
I don't know why.
Okay.
It just is. It's like just like me trying to push my finger through
So
soily, like mulch.
yes, yes. So um now what I'd like you to do is just spin that faster and faster and faster and faster. Just keep spinning it faster, faster and faster. Keep spinning it. Really be aware of all those things. Is there anything else that you're noticing about it besides that, the brown and
No,
the
it's just
smell
really
and
difficult.
what it looks like. So just keep spinning it,
Heavy.
spinning it, and spinning it, and spinning it, and spinning it, spinning it, spinning it, and 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 spinning it. Stop. Now, what I'd like you to do is begin to spin it the opposite direction. Okay. Now, are you noticing any changes? Are you noticing the color of it now?
Yeah, it is literally just sort of like just un unraveling. It's going green.
Yeah. Oh, lovely. And now what is the what does it look like? What's the texture of it?
Softer. It's just softer.
Soft. Okay. Green, soft. Does it have a smell? Is the smell changed?
It's fresher.
Fresher. Okay. All right.
And it could be somebody's mowing the lawn outside. I don't know. That's really weird, isn't it?
So you're smelling grass,
I
is what
know,
you're
and the green
smelling.
grass. I don't know. It's really weird. Yeah, I don't know if that's it.
So
But
you,
yeah, no, great. So that's what we do. And it's sort of like, and you have to make them jump so that
right.
it's the stop. But can you see? And it can be very, very quick.
Hmm.
And it's
Yeah.
just like, and it just all unravels. And it's really quick, it's really useful, and they
Right.
can do it with
Second.
each other, they can do it to themselves if necessary. And it's
Mhm.
just that that whole thing of just not having that feeling anymore. The
Yeah,
fact is that you've just pattern interrupted it.
sure.
And and sometimes it is quite interesting. People can tell little stories about stuff, and they start, and we know this, we know they go and tell stories all the time, and they can delete the story, as in they can distort it.
Yeah.
So they can delete the real bits,
Hmm.
add bits in. And now we have to be aware that obviously the majority of the people that we may well be seeing are more elderly. They like
Hmm.
to fabricate things to make
Yeah.
people feel sorry for them.
Yeah.
And we have to be really understanding that we really don't want them to get too much into their story,
Hmm.
because they love to, because they'll be treating us like therapists,
Sure.
and they will be moaning. about sometimes they will make nasty things up about family members not doing enough, and actually they're doing enough,
Yeah.
but
Yeah.
they want you to feel sorry for them because
Right.
that's what they want you to do.
Yeah.
So they make
For
things up.
me.
Yes, just especially
For
for
me.
you.
For me.
Yeah, for me. That's right. Because that's what they do. Now, so we always have to be aware of that, which is why a pattern interrupt.
Yeah.
So it's like, and it is quite funny because Mike Mandel does one. And I don't know if we can necessarily do this with people living with dementia or older people, but I'm going to throw it out there and see what you think. So what it is that you have somebody who's telling their story, all right, and all of a sudden they're in it, they're like feeling all this, like oh, my daughter, she doesn't come, she or when she does, she's just being all, and then so what he did was he just started going, and then she's watching him and going, what are you doing? Because she's trying to tell this story, and
Right.
he's going nothing, but he goes, carry on with your story. And now she's going, well, she doesn't do this. And he's going, you're smelling your watch. No, I'm not. Carry on with your story. Carry on with your story. And it's like, well, she does this thing, and yeah, and he's, what are you doing? You're smelling your watch. And he's like going, no, yeah, but it's like, yeah, but anyway, carry on with your story. But she kind of lost the thread of the
Yeah.
story
Yeah.
because he interrupted it.
Mm-hmm.
Now, it's funny, I did this with my son the other day, and I said I'm going to do something weird with you, but anyway, and I started going, oh, there's a fly in the so he was telling me this story about how his girlfriend, and it was like, and oh, there's a fly, it's a big blue, oh, it's a big blue bottle. Anyway, carry on. And because he was upset about it, and then I was going, oh, there's it, and he was like, and obviously it was on the telephone, so he couldn't see what I was doing. Anyway, he goes, I said, carry on with the story. He goes, I can't remember it now.
Ah,
Do you see what I mean?
yes.
Have some fun with that,
Mm-hmm.
with somebody moaning about something.
Sure.
If you've got a friend who's always moaning, you know,
Yes.
and now, hey, it's not to say we're not there to listen and be supportive and let people vent,
Yeah.
but it's for the moan, the moaners, all right, who are
Yeah.
always like, I don't know if you belong to a book group, the people who are always doing it.
Going on
Yeah,
about
yeah, there are always going to be. So
and
this,
they never stop. It's
okay, there you
hard
go.
to interrupt
Yeah.
them.
So it's like, so it could just be, oh, do you want a cup of tea? Or do you want to, that's very English, of course.
Mhm.
How do you have it? Milk or sugar? Oh, it's very stops people. And of course, is it rude? Yes. But it will stop the moaning if they're doing your head in. So just a little quick technique there for you, because they've lost their thread and they'll go on to something else.
Yeah.
Useful for people who are bitching about people.
Yeah.
If
Oh,
you don't,
yeah. Yeah, yeah, yeah.
yeah, and you really don't want to hear it, but they can't help it. So it's like that, because we all know that there'll be a lot of women doing this, so it's actually really quite a useful little thing to do, is to pattern interrupt that.
Sure.
And it's
Yeah.
just try it out. It's like a little game, okay?
Mhm.
But if we think about older people that we might be seeing and they're moaning, or if you've got the care partner moaning and moaning in front of their loved one living with dementia, and in
Mhm.
order to kind of like, because that's really unnecessary and they ought not to be doing that, but they
Mhm.
kind of can't help themselves sometimes because you've not had that chance, say to them, please don't do that in front of them. If you
Yeah.
need to vent, do it to me on a private phone call. I had to do that once, and it was like, thought, oh my gosh, please don't be saying this in front of him. Do you know what I mean? It was just like
Yeah,
really not very nice. Because the person listening to it,
I know.
you know, they feel shit. So
Yeah.
so that's why if we can come
Well,
in.
not only that, it's an energetic thing that people kind of begin to take on, whatever, you know, wherever those people are, it's easy to take on their energy. I mean, we do, we share our energy all the time. And
All
that's not a pleasant sharing. So we're interrupting it for us as well as we are them.
Yeah, so it's
And
a
that
good way
goes
to
both
interrupt
ways.
it.
Yeah.
Or, of course, you can immediately say, that feeling, that thing you're feeling, let's spin it, you know? So it depends how forceful
Yeah.
you are,
Exactly.
as a person, as a therapist, as a clinician, hypnotist, how you can pat and interrupt that. You can just go, that thing that you're upset about now, let's spin it. Okay. And
Yeah.
so here's another one now. All right. So it's like, again, you can say that thing that you're upset about. I want you to put it on a dot on the wall. Find something. There's always a picture, or there's always,
Yeah.
I don't know,
Yeah.
a crack
Sure.
or a light or
Yeah.
whatever there is. There's
Yeah.
something that they
Yeah.
can focus their attention on.
Yeah.
So now focus your attention on that and put that annoying thing, that feeling that you have, put it on there. Okay. And now scale it. 10 being the worst, 10 being the worst, zero nothing. Where are you with that feeling, with that thing,
Yeah. Mm-hmm.
that annoying thing? Okay. And so I'm going to do that with you now. So carry on. Is there something that you're it might not be, but pretend. Is there something that you're irritated about
Let me think here.
or upset about or anything?
Okay.
Got one?
Got
Okay.
one.
So what I want you to do is to look up and find somewhere where you can put that. Have you got it?
Yes.
You focus all your attention on that. Now, 10 being the worst, zero nothing. Where are you with that feeling? 10 being the worst, zero nothing.
Probably maybe about a 7.
Okay. So what I want you to do now is put your arms up like this and
Mm-hmm.
point your arms at that thing. Point your
Mm-hmm.
arm now,
Okay.
your fingertips at that thing. And then slowly, slowly open up your arms. Just really slowly. Keeping your attention focused on that point
Mm-hmm.
of that annoying thing, but opening up your arms really slowly until you can see your hands in the periphery of your vision. And now, how do you feel about that thing?
Well, it's just kind of fuzzied out a little bit.
Yes,
Just
less,
kind
isn't it? So where are you on your
of,
scale now? 10 being the worst, zero nothing.
oh, I don't know. Maybe a 1, a 2.
Yeah, because you put it into perspective.
Yeah. Yeah.
Amazing, isn't it?
Exactly.
Okay.
Yeah.
Again,
It,
so quick, no drugs involved.
mm-hmm.
It's something that they can do. I mean, they may have to have their arms lower and they may only get to that with their eyes if they've only got
Yeah.
one eyeball. I've had all that. It's just it's whatever it is. But
Mm.
that is like, oh,
Expansion.
okay. It just changes the whole perspective of that thing
Yeah.
that is
Yeah.
that is, and it could be a family member. It could be their housekeepers didn't
Yeah.
clean something properly.
Anything. Yeah.
Anything, the guy who was meant to turn up and they didn't mow the lawn. But
Yeah.
for some reason, when people are older, they take it personally, just like kids do.
No things. Yeah.
And it's like they don't like me. They
Oh,
start telling stories. And it's like, right, that thing you're upset about, put it into perspective. You're going to let that one thing ruin your day? Really?
yeah.
You see?
Yeah.
So it's about, or spin it. So there's a couple of techniques there. So just go over that one with me now, so that, because I always think we learn it better if we then do it on somebody,
Okay. All right. Oh, I know you're really frustrated about this thing, Claudia. So what I'd like you to do is just look at the ceiling and pick out a spot and and put that thing up there in that spot on the ceiling. And as you're staring at it, take your arms, put them together, and point up to that spot.
And remember to get me to scale it.
Oh, I forgot the
That's
scaling.
all right. Don't worry.
We'll
That's one.
scale it then before
Okay.
we
Okay.
expand it.
Eight.
Okay. So, and as you do, you've done that. Now put your hands up and point at that particular spot, and then begin to separate your hands little by little by little. Separate them, and you begin to see them in your peripheral vision to the side as you stare at that spot. Like almost like you're opening up. So making it even more fuzzy. So there you go. But how do you feel now?
Yeah. 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 It just didn't bother me. Didn't bother me. It's just like, it could just feel it, like, just because it's like a timeline. Okay. So it's
Mm-hmm.
like, really, you're going to get that small thing irritate you, and you've lived, and I say to people, you've lived all these years,
Yeah.
and you're going to carry on living,
Right.
if I've got a youngster, I'll say you're going to live right up till you're 100, and you're letting that one little thing upset you.
Yeah. Yeah.
Like one exam, or your driving test, or that aunt who said that, really, you know
Yeah. Yeah.
uh,
Yeah.
the fact,
Make it that's
one test you didn't do so well on, you're going to focus on that and make that here. It's like, oh yeah. So I
yeah.
do have a story that goes with that, and I'm going to read it to you,
Mm-hmm.
and I'm going to put it, I'll send it, I'll make sure it goes in the files,
Okay, great.
because I read this first, in all my sessions, actually, and then I do that with them. But it's a really useful tool. Now, again, we have to remember that not everybody can move their arms, not everybody can, do that. But we see people. You may be having the care partners may be younger than the
Mm-hmm.
person living with dementia.
Mm-hmm.
Maybe it's the children you're seeing,
Mm-hmm.
so
Sure.
it's like, it's just about, again, it's not always going to be their life. It's because we see a lot of people, a lot of our clients will be the middle-aged ones, say like me, who have children, and I think I'm a bit older than middle-aged, but anyway, but that have the younger children and older parents. They're
Yeah.
in the middle,
Yeah.
the sandwich people, and they're like having to handle both. So they may be coming. Okay, so this is a really useful story. An aging Hindu master noticed that a certain apprentice would often feel down and complain about his life, and so one morning sent him for some salt. When the apprentice returned, the master instructed the unhappy young man to put a handful of salt in a glass of water and then to drink it. "How does it taste?" the master asked. "Bitter," spat the apprentice. The two walked in silence to the nearby lake, and now the master instructed the younger man to cast another handful of salt into the clear lake. The old man now said, "Now drink from the lake." As the water dripped down the young man's chin, the master asked, "How does it taste?" "Fresh," remarked the apprentice. "Do you taste the salt?" asked the master. "No," said the young man. At this, the master sat beside this serious young man, who so reminded him of himself when he had been young, and took his hands, offering, "The pain of life is pure salt, no more, no less. The amount of pain in life remains exactly the same. However, the amount of bitterness we taste depends on the container we put the pain in. So when you are in pain, the only thing you can do is to enlarge your sense of things. Stop being a glass, become a lake." Isn't that so clever?
Very nice. Yeah, very clever.
So, so it is like life is shit. This sucks sometimes. We
Mm-hmm.
have to really validate people and
Mm-hmm.
go, yeah, it's horrible.
Yeah,
And now that's when you can do that.
yeah.
Okay. So I'm going to send you both, take a picture of it and I'll send it both to you. All right.
Mhm.
So it's because, yeah, I am, and I'm currently, I've got a friend of mine, it's very sad. Her husband just died last week.
Mm.
And he lost his speech, couldn't speak anymore. And he did go down, he did decline rapidly just in the last 8 weeks, but he was using an iPad still to write.
Mhm.
And he was 87. He passed suddenly, but although probably not quick enough for him, maybe.
Yeah.
Um, Now it's so we've now got the grief, because actually for the care partner, what we have to understand is that this can then be a lot of fear for them, is that, well, who am I when I'm not the care partner anymore
Yeah.
as well? And
Mm.
that's because there's a void.
Mhm.
And it's very it is very sad, and it sucks.
Yeah.
So let's validate people and hear them and sit with them. And I think that goes back to me always thinking about Winnie the Pooh and Eeyore, because they never said, "Oh, do this, do that," like a lot of people do, because they don't
Mhm.
want people to feel their feelings. They don't want people to be depressed.
Yeah.
It's that whole thing of, I think there was a little piglet sitting next to Pooh or one or the other, saying, "I'm just going to sit here with you and feel with you." And
Sure.
that's sometimes what it's just about. It's just, it sucks, and validating them that right now,
I'm just gonna be here for you, with you.
yeah, sit here and feel, and yeah, and
Mhm.
know that, because it is, you can't just like, oh no, you're not allowed to feel your feelings, you've got to be fine for me. No,
Mhm.
it's just like, no, it really is awful at times. It
Sure.
hurts. It hurts.
Sure.
um and we have to make sure people are allowed to feel their grief. So, and which leads me on to thinking about the care partners who have resentment towards the person they're looking after.
Oh, sure. And I think that happens a lot.
It happens a great deal.
Yes.
And suddenly they're now having to look after their mother, who has forgotten that they were so nasty to them,
Mhm.
and they're expected to be there for them,
Right.
even
Right.
though as the mother they weren't there for them when they were a kid, because that's what society says, or because they feel guilt tripped, or because people are watching what they're doing. You know,
Yeah.
it's really hard. And again, we may have to be the ones who are there to validate them and agree with them that sucks. It's hard.
Yeah.
And so this is why I do a lot of the helping people feel indifferent towards those negative feelings, so
Mhm.
that they aren't hanging on to that resentment. I can't, not magic, okay, can't actually take away what happened, but
No.
that that feeling of
The
being,
emotion is what we want to deal with.
yeah,
And that emotion keeps them present. So what are they going to be present with? You know,
yeah.
exactly.
So we have to help them feel indifferent towards that. The and anger, of course, we know that they because they can't necessarily be angry with this person who is now not doing so well,
Right.
because then they would feel guilty, but they're still angry with who they were. But who's holding on to it? They
Yeah.
are.
Right.
So we have to do, help them understand about. So I never say to somebody, I'm going to it's about forgiveness. All right. I'm never going to say you have to forgive them. I personally believe that it's their choice to forgive and they get to choose to if they want to.
Yeah.
What I can do is help them feel indifferent towards that thing that happened so that it is easier to choose to forgive again if they still choose to. Um,
Yeah.
However, once we invite people to realize it is for themselves to release themselves from that uh, poison, um,
Yeah.
and that they don't need to hold on to it, then it is easier. It is easier for them to do, and that's where the Ho'oponopono prayer can come in, or any other kind of.
It's really great.
Yeah, I use
I
that.
just got a method for just completely releasing anything that's really, really traumatic that's happening and really affecting your life every day. It's a very nice Ho'oponopono. But what I really focus, and this would be for the caregiver, of course, I think more than anybody, is I teach my clients to use their emotions as their guidance. They're guiding them. The subconscious mind has brought this emotion up, and it could be from past things that they've had with this person that they're caring for, whatever,
Mhm.
but the emotion is there. And what typically happens, and then that's the subconscious communicating with the conscious mind, then the conscious mind starts thinking all these thoughts, blah, 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 and it goes on and on and on and on. So if they take that emotion and they use it, I ask them to get even with it, breathe, take a few breaths,
Mhm.
identify the emotion. It's really important. Um, Take a few breaths, breathe, then ask yourself, how do you want to feel? And when they tell me, what it is, if they're angry, so to speak, they might want to feel more compassionate. How do they really want to feel in this situation versus being angry? And I just have them give me a couple words. It could be, um, it could be compassionate, it could be understanding, it could be patience, it could be whatever, it could be a few of those words. And then I just have them say those words over and over. It becomes their mantra.
And that's very interesting because that's what we do with havening, and you
Yeah,
haven it in.
right.
Get them
Right.
to say, yeah.
Exactly. So that's a great thing to add to that. Havening, I've done that as well to
Mhm.
that particular thing. But if they continue to just take time during their day, continue to say those words that are important for them, how they want to feel. So the emotion then becomes their guidance. It's just guiding them. It's telling them we don't like that. It's like when we're a kid and we burn our fingers on the stove that our mother told us not to touch or whatever. We have that memory of what is hot and what burns. And when we're around fire or we're in a situation like that, we're very cautious That's our subconscious mind communicating that to us. It communicates the same thing through the emotions, and it tells us, well, we don't like that. I don't like that. That feels really crummy. It's really, having a bad effect on me. And what do I want? How do I want to feel? That's the
Yeah.
big question. How do you want to feel?
Yeah. I always ask my
That's
kids,
the choice.
what do you want? What do you want to feel like? If I was to ask
Yep,
you this magical
yep,
question.
exactly, exactly. So it just all kind of goes together really well, I think, with those kinds of things. In fact, I've worked with caregivers that and with that kind of thing.
Have you?
It's been
Yeah.
very helpful, you
Yeah.
know.
To fit, yeah, because if they're
Right.
going to do, and I mean, it could be that, their partner was unfaithful to them,
Mm-hmm.
and again, you can often get that when people suddenly get cancer. They're about to get divorced, and then one of them gets cancer, and is,
Mm-hmm.
and it's like, well, now I've got to stay with them, you
Yeah.
know, and
Yeah.
it's like look after them, but they would treated me like absolute whatever, it's just there's so
Yeah.
much, and that I think anger like that for yourself and the resentment is so it can just eat away
It
and cause
doesn't
cancer
matter who you're,
yourself.
it doesn't matter what you're angry with. It
No.
doesn't matter. I always, as I look at the door, I said, it doesn't matter if you're angry with the door. The door doesn't necessarily get it, but you do.
Yeah.
It implodes within us. We're the ones that suffer from any kind of anger that we have. It comes back to us. You know,
And
it's
then it's that horrible energy that nobody actually wants to be around.
right, right.
And it won't be able to come out. But so if you are angry, if you're an angry care um partner, and you are like feeling that anger, then the tone of voice is going to be,
Right,
what do you want for dinner?
mhm,
Instead
right,
of, what do you want for
exactly,
dinner? Sausages or
exactly,
tuna?
exactly.
It's
Mhm,
it's not going to be pleasant. It's really important that we find that out uh,
mhm.
in a session, and it could be that you do that on the telephone. Do you need help in any area? Because
Yeah,
it's but because we can, and that's where you're also suddenly seeing. It's like if they've said, oh no, we're fine, but then you're in this situation, you're at their house, and they're suddenly going on about, oh, he's doing this, he's doing that. You're thinking, okay, let's spin this. And then I have said to people, can you come to my house for a session?
yeah, yeah,
The care part, it's
yeah.
like, because we need to let go of some of that. it's
Mhm.
it's unhelpful for the
Sure,
situation,
sure.
um and it's true that that needs to go in whatever form you use, of helping people let go. I use a lot of eye movements, and I
Yeah,
use stuff,
sure.
and but everybody will have their own ways of helping people. So but I think that's been, quite meaty today. It's been really useful, um
Mhm.
to go over that. What other tools might you use as well to help people let go of? We've got pattern interrupts, we've got that, we've got the, perspective.
Mhm. Mhm.
Um, do you use any other things, Carrie Ann, to help people with, if they're to stop them from feeling something, an anxious thought there and
An interrupt like that type of thing. Um, Richard Nongard has a 3-2-1 thing, which I think is really great too. And that is just taking 3 breaths
then? Hmm.
and then it's like a havening thing. Just hug
Okay.
yourself or do this. Give yourself a hug. Okay. And then take 1 minute and just meditate for a minute.
Yeah.
Okay.
Yeah.
Breathe, whatever, is good
Yeah.
for you. But that's,
It is. That's another protocol. So there's another one. There's a Lima one. Okay.
mhm.
And it is, so it's called L. So L is for loosen up.
Oh, yeah.
Okay.
Mhm.
And then inhale. Okay. As you say. All
Right,
right. And
right.
then um sort of like close your eyes and just go to a nice place in your head, meditate a bit. And then
Mhm.
the A is an affirmation saying, I'm okay, I'm
Yeah,
okay.
okay.
So
All is well.
there's
All
this,
what I like is all is settled, all is well.
but shaking things off is another one.
Yeah,
Literally
yeah,
people need to move their body. So we
yeah.
know that when animals, we've seen it, gazelles, they actually get away from the lion, and then,
Right.
they go off somewhere and literally for about 5 minutes go, ugh, ugh,
Yeah,
ugh.
yeah,
So it's like they're literally, shaking it out.
yeah,
Um, so animals know, they really do. So I tell another story of people how to let things go, because there are some people hold on to really silly little things.
yes.
Um, we all do because we're human, okay? But this is a story I tell, and it's my monkey story. Monkeys live in the jungle and they go from tree to tree, so we can't catch them. So what we do is we bury a vase shaped like that. We bury it in the sand or the soil. We put in a shiny stone or some fruit, and then we go and hide in the bushes. Now, Monkey has been watching you, and monkeys are very curious. So Monkey climbs down the tree, pops his little hand in, grabs hold of the shiny stone or the fruit, and he makes a fist. And he can't get out. You come over, pop the net over Monkey. Monkey's trapped. Monkey's lost his happiness. Monkey's lost his freedom. If
Mhm.
only he'd let it go. And then I get them to do that with their hands. Let
Yeah,
it go, let it go,
that's great.
let
I
it go.
like that.
Yeah. And
Yeah,
then I literally immediately go on to, because you are this magnificent tree and
yeah.
these branches, and a bird comes and lands in your branch, and a bird is the thought. Okay, well, we all know
Oh,
what
yeah,
happens with birds and thoughts. You get another thought, another bird
yeah.
in this branch. Got all these branches up here full of birds, full of thoughts. Then they make nests, then they have babies, and then they crap all over your tree.
Oh, I love it.
Started with one bird, one thought.
Yeah.
We will all have the thought. So then I say, put your hands out like this. I'm going to put the thought of a feather in that hand and the thought of a kettlebell in that hand. Which one's heavier?
Yeah. The kettlebell.
No, they're both the same. It was just a thought.
Yeah.
But isn't that it? And everybody says that, but isn't that interesting?
Yes.
Can you
Yeah.
see how heavy we go
That's
with the
cute.
negative
Yes.
thought? So,
Hmm.
so I tell people, you will have the thought. We have 70,000 thoughts a day. 53,000 of them are negative. We are
Yeah.
primed for negativity. Goes back to caveman days. Fight, flight, freeze. Looking out for saber-toothed tigers. Other tribes.
Okay.
We're always looking out.
How many thousands was there?
70,000 thoughts a day.
70,000.
Well, that's what I learned from
Yeah,
Larry
I've
Garrett.
heard that.
Anyway,
Yeah,
evil
I've
ten,
heard that too.
and then
And how many of them are negative, do they think?
53,000.
A little over half.
Yeah, isn't that crazy?
Yeah. Yeah.
53,000 are negative. So you're going to have the thought.
Well, we've got a lot of negative influencers out there.
We're going to have
That
the
has
thought that
become.
life sucks. We're going to have the thought that why me? Oh dear, oh shit, oh la 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 la. So
Yeah.
then I do this little line for people. And just do it on the back of here. So it's like 10% of the day, no matter what, we are sad.
Mhm.
10% of the day, we are happy. Okay, can you see that?
Mhm.
Now, there's a bit in the middle. Now, there are more unhappy millionaires than there are happy millionaires, and that's because they are not billionaires. So they're always thinking, I'll be happy when.
When?
I'll be
Yeah.
happy when I've got a bigger yacht. I'll be happy when I'm a billionaire. I'll be happier then. So they fall into the gap. Now, if they'd looked at where they'd come from, and what they have got and what they have achieved,
Right.
then they'd go into the game. Now, so it's always about becoming. Now, how on earth are we meant to try and get that over to somebody who's living with dementia? Well, it's look at the life you have, what you have got around you.
Right.
And that's
Right.
going to be easier said than done with some other people. You might not
Yeah, I was
use that
just
with
gonna
some
say,
people
yeah.
at all.
Yeah.
Okay. But look at where you have come. But as they start making progress with the brain health coaching, then
Mhm.
it's look at what you were before. Your MOCA score was 19. Now it's 21. Look at what you have got. Look at what you are eating. Look at how much exercise you are doing now. So
Yeah.
it's about becoming, back to that dementia thing, regaining of cognitive abilities. It's back to
Mhm.
regaining. So that instead of being all like this,
Right. They're back.
which is what they would have been before you would turn up and start doing just calming things like,
Yeah.
getting their central nervous system calmed down with some relaxation, mindfulness, teaching them
Yeah.
self-hypnosis. They then get back to balancing. Every so often they'll do that.
Yeah.
They all do.
Mhm.
It's how quickly can we get back to balancing? Well, I don't think we're ever fully balanced. We're always balancing. Occasionally we might be,
Yeah.
but there's
Yeah.
always something. There'll always be something.
Yeah.
They're always
Yeah.
balancing life.
Actually, that's what my frequency technology does, brings that into balance,
Yeah.
brings those emotions into balance. And it's reading the voice and whatever the voice is saying.
All right.
And especially in relationship to whatever anybody wants. I always tell people to think about what they want, think about an affirmation or whatever. Then the technology will begin to balance, and it'll work on the subconscious, all the things in the subconscious, to bring that into balance. And then whatever is in the current reality, and it brings the emotions into balance.
Nice.
So it does that. But you have to give it direction. You can't just, I think it's important to do that, to be involved with it,
And life.
anything like
Yeah.
that. Yeah,
Yeah.
you have to be
So that
involved.
we get back to balancing. I mean, that's why my Facebook group is called Becoming a Happier
Yeah,
You, because we can
yeah,
never be happy 100% of the time. Who said
yeah,
that?
yeah,
Who said we have
yeah,
to be
yeah,
that?
yeah,
That's impossible.
exactly.
So
Because we've
it's always
had things that have influenced us that haven't been very happy or very nice. And so,
about becoming,
mhm,
becoming balanced
yes,
and
exactly,
balancing life as best as
exactly,
we can. And
exactly.
that's what we do as Lighthouse brain health coaches, so that we can help people do that. Yeah, any questions on any of that, Carrie Ann?
No, I think it's lovely. It's lovely.
A big load of tools today.
Pardon?
Big load of tools today. Useful.
Yes, wonderful tools.
And for
Really great
all,
tools.
yeah, and for
Really.
all our clients, not
Sure.
you know,
Absolutely.
people are people,
Absolutely. Yeah,
all ages, you know,
exactly.
all ages.
Exactly.
So yeah,
They
so
are, and we all have that. We're not the same. We're so unique in every different way. Um, but there are some things that are very common to help us, just the basic way our mind is working, and you
yeah.
know, and our body, and how our body influences our mind influences our body, and all that kind of thing too.
And there'll always be one tool that somebody likes more than another. And,
Oh,
it
sure.
could be that one, it could be that one, it could be that one. It's like, everybody will have their favorite, or they'll have it for a bit and then remember that one. And, it's
Right.
whatever it is. But
Exactly.
it is important to, yeah. And bring back humor.
Yeah. Yeah.
So
I
important to bring
agree.
humor back. into everyday life. And, you know, watch funny things.
Yeah.
You know,
It's
it's
so great to have a good laugh.
yeah. Well, laughter is the best medicine. You know, it really is.
It is.
You know, it's
It
like
is.
it conjures up that the giggles inside, instead
Yeah.
of it being all so serious and
Yeah.
awful.
Yeah.
So, but anyway, yeah. So I'm going to stop the recording there
Okay.
because that's probably enough for there today.